preschool, elementary. And so even in teens, obviously, that we deal a lot with parents having to be that person that implements and facilitates so many of the strategies, right? They're the main, it's not treatment just in the office, right?
No, I mean, in the main, I feel like one of the main things that we try to convey, and you probably do the same thing, is that we really are working to try to eventually pass that baton from us holding it over to put it into their hands and hopefully into, even for the kids to be holding part of that baton as well, right? We want them to be active participants in their treatment and really thinking about what they can do outside of the session, but really like we want to pass that control over to them. Like and they can do it. Like it's, I think it's just kind of hopefully being able to make them think and feel confident that they got this. They can do it. We don't do anything magical. We're just like, we just help facilitate it. And so hopefully we can relay that to the parents as well.
I think one of the things I find so interesting when I talk to other experts in the field is that when you're having success with this population, you have to be doing similar things because you wouldn't be getting success, right? You may call it something different. You may come at it at
There's a lot of different terms, right? Yeah.
And come at
exactly.
it from different angles. But yeah, like parents, I always say, don't wait, facilitate. Parents are the facilitators, the implementers, and teachers the same in school. Kids don't come with a guidebook, but a big part of what we do also is giving these kids that sense of control and helping them be such an active participant, whether it's a game they're playing as a little guy or it's an active, concrete goal. And then, there's so much to talk about, but one of the focuses or a focus of today is, okay, parents are key, right? But a lot of our parents have a lot of anxiety and fears of their own. And that can really affect progress and the messages they may be projecting onto their children.
Yes, I think you're exactly right. I think we kind of know from the research, right, that anxiety kind of hangs in the family tree. So unfortunately, if there's anxiety in that kiddo, we're more likely to find a parent with some type of anxiety. It doesn't always have to be SM or social anxiety, but there's often anxiety there, which kind of just predisposes them to have a little bit more difficulty if they're trying to then encourage their child to then face those fears that maybe they've had trouble facing themselves. But it's something that the nice thing I think about this work that we get to do is we don't just work with the kiddo. We really work with the parent also in thinking about how can they also use some of the same strategies that we're teaching these kiddos to help themselves be able to implement these exposures, right? So thinking about using that same cognitive triangle, right? So what are their thoughts, feelings, and behaviors that get kind of activated for them when they're about to approach somebody to encourage their child to speak to? They have to do all of the same things that we're asking of that child. So I think really helping, we've kind of taken some steps that are like called support steps or prepare steps that they can kind of think about as they get ready to engage in an exposure task, right? So really understanding what are their thoughts in relation to doing that exposure. So are they ready? Are they feeling anxious about it? What do they think is going to happen if they do it, right? I think they have similar negative kind of or unhelpful thinking related to some of these exposure tasks. And then how are they feeling about it emotionally? They're probably, like you said, maybe their heart's beating fast, their face is getting flushed, they're feeling ready to run, right? And so if we can help them identify those in advance of engaging in those exposures, then we've actually seen them be much more willing to kind of engage and step forward. And it's amazing modeling too for the kiddos to see, maybe not in full detail, but that mom and dad or grandma or grandpa are also working through anxiety, that's something that we have to manage all the time, and that they can do it, and that they're also able to engage in those practices similar to their kiddo. So I think I really like being able to kind of talk through that with them. But also I would say these days we do a lot of modeling where we are actively kind of doing some of those exposures first, where the families are watching us do it so that they have a better sense of what does that mean if like I have to go up and talk to somebody and tell them that, you know, my kiddo's going to ask them a question, and so that they can see us do it. And hopefully we're modeling and showing that you can do this. We got this, right? We can put on our brave caps, and then often then we'll kind of switch roles and have them implement it, but we're kind of there to support them. So we're kind of doing that graduated exposure even with them in implementing those exposures with their kiddo, which seems to be working pretty well.